My guest joins us to share his public health journey, which includes work at the state government level, the federal level as an epidemic intelligence service officer and director at CDC, work in academia, and service as a U.S. veteran. You're listening to the PHEC podcast, episode 409. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations, and government agencies. We specialize in a variety of community assessments, in general, helping our clients collect, analyze, manage, and communicate their health information in plain language to the communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, which is drchuntley.com. We'd be really happy to meet with you and explore how we may be able to support your organization. Links are also going to be provided in the show notes in the description for this episode as well. I'm really excited to introduce you all to our guest on today's episode, who is Dr. Scott McNabb. So let me formally introduce him to you, and then I'll connect our conversation. Prior to joining the CDC Epidemic Intelligence Service and serving this 2-year residency in New Orleans, Louisiana, Dr. McNabb worked at the Oklahoma State Health Department, and he talks about that during our conversation. Most of his efforts focus to serve those in underdeveloped, underserved global settings. From 2006 to 2008, he directed the Division of Integrated Surveillance Systems and Services, National Center for Public Health Informatics at CDC. Before retirement from CDC in 2010, he was Associate Director for Science, Public Health Informatics and Technology Program Officer for Surveillance, Epidemiology, and Laboratory Services. As a service-connected, disabled U.S. veteran, Dr. McNabb manages Public Health Practice, LLC, and serves as adjunct professor at several universities globally. Having mentored over 100 students through their MPH or PhD, plus 14 CDC fellows, he works on many global projects and has published 2 books. He also serves on the editorial board for Epidemiology and Global Health. Let's connect my conversation with Dr. McNabb right now. Good morning, Scott. Welcome to the podcast. How are you doing?
I'm doing fine, Charlotte. Thank you so much for all you're doing. I appreciate your help.
Yeah, this is a good conversation. I know we talked a little bit a while back. I got to know you just a little bit, and I know that what you're working on now is something I wanted to bring to the podcast. So I'm excited that we have been able to carve out this time despite the calendar jumps and little technical difficulties. We're finally having the conversation. So why don't you take a moment, just introduce yourself and tell everyone what you do, who you are, a little bit about you.
Okay, thank you, Charlotte. First of all, I'm an epidemiologist. I was trained as a laboratorian. My PhD is in microbiology and immunology. And I spent the first part of my career working at the Oklahoma State Health Department. Epidemiologist nominated me for the Epidemic Intelligence Service, and I joined the EIS program, spent my 2 years in New Orleans, and worked there doing some really interesting studies working with the Louisiana State Health Department. This was at a time when the former Soviet Union was breaking up, and I had an opportunity as an EIS officer to travel to Afghanistan and to work in Kazakhstan, all of Central Asia and the Caucasus. And Armenia was a country that was really difficult circumstances. They were at war with their neighbor. So I began to work extensively in the country of Armenia, which was one of the 15 former republics. I also worked in the Republic of Georgia and Ukraine. And then at CDC, I spent 20 years at CDC. My last position was directing the Division of Integrated Surveillance Systems. So I ran the surveillance activity at the national level. And then after my retirement, joined Emory as a faculty member. And so public health is, I'd say, my experience of what I've dedicated my life for.
Yeah, very extensive career. We're going to dive into a lot of the things that you kind of touched on in that introduction. One of my favorite questions on this podcast, as I get to know my guest and hear about the journey, is when did you first hear about public health or consider public health as a career?
Yeah, it's a great question. Well, as I said, my undergrad was in biology, and I didn't really want to go to medical school. I was trying to search for a job after I graduated and after I got out of the Vietnam situation, and then just happened upon an advertisement in the paper for a public health librarian. And I thought, well, I'll apply. And fortunately, they accepted me. So part of it was just looking.
It's interesting to hear you describe your beginnings because I was on a pre-med track, but I had a lot of zigzags and curves in there. But I transitioned from healthcare into public health, but I worked in the state public health lab and in the microbiology division. But our bureau chief was actually retired from the Army. So his background in laboratory work was through the Army, and he had completed his PhD in public health. And he did not specialize in epidemiology, but I showed a lot of interest in epidemiology, so he encouraged me to go that route. All right, so my next question is, what population or issue or challenge or problem in public health are you most passionate about now?
Yeah, thank you. It's a great question. Public health surveillance is the area of expertise that I have developed and continue to work in. That means for public health officials all over the world, not just domestically, but in the global setting with WHO, et cetera, to be able to know what the issues are in their specific community from a public health point of view and to take the responses needed to try to protect their citizenry. So I'm thinking about the information and the technology, the communication tools, and the other elements of public health surveillance so that anybody in any country, and we started the collaboration with the Africa CDC and began that work over 5 years ago. I've worked with the WHO in other settings and also in the US. And it's time now for us to rethink how we do public health surveillance. So that's my area of expertise.
Nice, nice. Well, I guess that's a nice segue into my next question, too, because I really want to talk a little bit more about your current projects, what you are working on right now. Could you speak to that a bit? Like when you say we, talk about who we are, and then tell us a little bit more about what you're working on right now.
Okay, very good. So right now we are developing what I call the best practices for multi-communication online e-learning. I'm on the faculty at the University of Georgia teaching 2 cohorts of transforming public health surveillance, which is the class that I teach. This is taught online with the online MPH program that UGA has set up, and also through their regular epidemiology and biostatistics department. Teaching online addresses the needs of students. Many students can't physically go to class and so forth. Many of them have jobs, many of them working at the CDC right now, in fact. And I teach 3 courses online at Columbia University in June: successful scientific writing, how to write a scientific paper, and scientific communication for leaders, how to communicate effectively. Science communication is very, very important. And the 3rd class is called Modernizing the One Health public health surveillance activity using what we call generative ethical AI. And we have a proposal on the table to basically transform public health surveillance, not only in the United States, but also globally. And we're working with Google and other large providers that would sort of support this effort. So right now is a very important time for us. It's a shaking going on in the government. I understand that maybe up to 40% of the US CDC budget is going to be cut, 30% of NIH. So this is a time when I talk to my students about stepping back, take a deep breath, and realize you're there for a purpose to try to make a difference. So we have a new model that we want to propose for collecting public health information, which minimizes the drama and trauma on medical practitioners, but also provides the information needed when it's needed, where it's needed for the public health officials.
So would you say we, all three of those universities, are collaborating with you on this project?
We have a collaboration at the University of Georgia. Also, I have a team that's worked with me on these projects before. We've published 2 books. So these are a team of experts who are very much involved in information technology and also public health surveillance. So we have a group that we can put together very quickly to do this project. We do want to identify specific geographic areas like Indiana with Regan Street. We have a team, we want to collaborate with them. Also in Georgia, we believe if we can do an applied research study in several areas at local and state health departments and demonstrate through a very rigorously defined monitoring and evaluation plan with indicators that everybody would agree to, we can see if our ideas work better than what is currently being done.
That's fair. So what do you mean by, I'm just poking to pull out a little bit more, when you say ethical generative AI for public health?
It's a good question. So think about what's happening now. When I was at CDC, I worked with a team to develop what's called abstraction of reportable conditions from the electronic medical record. I thought, well, that's really cool. A physician or a nurse or PA could be entering information about measles. We have an outbreak of measles now in the United States. Who would have ever thought? And that those reportable conditions could be abstracted from the medical record and then reported to the public health official. And I thought, oh, well, that's really cool. Well, this has been going on now for, almost 20 years, and it's really not working because public health has a different workflow process than healthcare services. If you are a physician and let's say your child is sick with fever, night sweats, and you take your child into the doctor's entering in information into the electronic medical record, maybe want to take your child to a laboratory to have testing done. If it is a reportable condition, and physicians are required by law to report a certain set of reportable conditions in every state to the health department, right? That's what their obligation is. They are burdened by, do I have to enter that into a different system? It's not these, for 120 electronic medical record systems in the US don't really interoperate very well. So how can we get the information to a public health official like I was sitting in front of a computer screen, let's say at a county level? Oh, there's a case of measles in that location. Oh, there's another case of measles. How do we get the information in front of the public health official quickly so he or she can make a determination and take the action? And ethical generative AI, when I say ethical, that means that we have to protect the patient's information. One of the good things that our country has done is protect information from being misused in the electronic medical record system. I don't fear that my health information, which belongs to me technically, I think, is going to be shared or given to some other entity without my permission, right? So ethical, we have a proposal that would establish a module. First of all, let me say that public health has a different workflow system. Many of our diseases that are seen by veterinarians are not going to be seen in a doctor's office necessarily until way down the road. So we have what we call data entry once, which means that the physician, nurse, the PA should be entering information. Let's say it is measles with the information that's collected, demographic information, laboratory information, epidemiologic information, and it goes into the healthcare delivery system, which is very important. We believe we can create an environment where information automatically also goes into a public health ecosystem using ethical generative AI so that it's called data entry once. The physician doesn't have to re-enter the data on a reportable condition, that AI will capture, look at the variables that are entered in to the electronic medical record and determine if they fit what's called a case information package for a reportable condition, and then immediately communicate that to the county health official in a way that the county official can take action, like a line list or an epi curve. So we can streamline this work that happens in a doctor's office. So it minimizes the drama and trauma to them. Ethical AI can be generated, and we have the details of that in our concept note. But also we want to make sure if we create this public health ecosystem that other people can enter data, like veterinarians, pharmacists, because we get data from other sources, even people. We believe in what's called participatory surveillance, that the population should be involved with public health surveillance, not be an afterthought. We have concept notes and presentations that would describe this. We have an attorney that's working with us as well who wants to make sure that this ethical adjective is really fulfilled, meaning that if the AI is capturing information that's entered into the electronic medical record, determining if it's a reportable condition, and each state has their set of reportable conditions I mentioned, and then the information is communicated to the county, state, and national health leaders, public health leaders, based on their agreement. We can use AI to streamline things.
Being in that position, working in hospital systems in healthcare setting, and then also in public health, I'm definitely aware of how disjointed the communication is. I've been in a position where because there's a microbiology in hospital systems, so when I isolated certain bacteria and certain infections, that was reportable, and I was filling out paperwork or entering that in. When I got to the state level, I was very aware of just how inconsistent our computer systems were speaking to each other. So I completely get what you're saying in terms of the problem.
And burdensome too, I think. Very
Very
burdensome.
much so. I think that this is a very interesting direction to explore. And what is your challenge with this, or what is kind of the obstacle that you're up against right now at the time we're recording this?
Well, let's look at the circumstances. Right now, we have almost a 40% financial cut at the US CDC. And the US CDC and in public health in general, as you know, over the evolution of this field over 80 years, it's grown into silos. There's TB, there's HIV/AIDS, hepatitis. Each one of the divisions of CDC is a silo. And it's a part of that is a part of our training and so forth. And I'm not trying to point fingers or blame anybody, but it's an evolutionary model which needs to be redone, basically. We developed what we call integrated public health surveillance in Africa, working with the WHO AFRO team. They have deployed integrated surveillance, which looks at surveillance by the function, detection, registration, reporting, etc., not the disease du jour. And so the U.S. is a little behind because public health is still in these silos. Now, so in my view, this sort of shaking that's happening in public health is a moment of opportunity where we can demonstrate a better way forward. And so we have a proposal. We have colleagues and collaborators who are willing to work with us on this. And it's a big opportunity to show a better way forward in public health, meaning integrated. Now, this is integrated is used in Africa. It's used in India. WHO has adopted it. So it's not something that's not well developed, so to speak. But we need to move into an integrated framework in the United States and also move to One Health, where we actually capture information from veterinarians, veterinary labs, and pharmacists. As you know, probably fewer than 5% of salmonella cases are actually end up in the public health reporting system because people get sick, fever, they may have, diarrhea and so forth. They go to a pharmacist, get some sort of a medication across the counter, and they get better. They never go to a doctor. So we need to be able to involve the public in this process too, which is another domain. So we're looking for support to do applied research projects. We're scientists. So we believe that we have a proposal that if it's demonstrated at a local and state health department, that we can show with monitoring and evaluation plan and indicators that this is a better way forward, that this actually removes the drama and the trauma to the medical practitioner and makes a public health ecosystem, develops it, defines it, and provides the information needed by public health officials. So we're looking for, right now, because of this shaking and the reduction in the U.S. government's expenses for CDC and the NIH, this is a moment in time for us to try to do something that would make the world better and public health better. And so I have many students who are very, very interested in this, and we're looking for grant opportunities or funding opportunities so we can pilot test it because we're scientists. We want to demonstrate that it'll work.
Sounds good. Very good. Well, for someone who's listening and interested in what you're saying, and again, at the time of this recording, this is the end of April of 2025. You may be listening at a year in the future from now, but from the time of this recording, but we will share the links and connections to you so that someone can connect with you and just find out where you are on the progress with this project, or if they're just interested in general, to be able to connect with you and be able to support you where you are and maybe share insights and continue conversations.
I just have one more point, and that is, if we look at the opportunities, we know that information communication technology is exploding. One of my students has developed a plan to deploy Starlink throughout Africa because internet access becomes a very important opportunity and a challenge. But using artificial intelligence, using the tools that we have with information communication technology, we believe we have a better way forward for public health surveillance. And that means also working with big funders, Google and Microsoft and so forth, because this is a global vision we have, working not just for the United States to make sure information is available when it's needed, where it's needed, and it's One Health, but also in the global setting. So we look forward to collaborating with you. Thank you for what you do, Charlotte. It's very important.
Yeah, well, I appreciate you bringing this innovation to the conversation, to the podcast, and also representing this interdisciplinary power where public health can overlap other industries, and there does create a power and strength for us as a whole. And One Health is a perfect example of that. So many opportunities to be able to bring together the interconnectedness of environment, people, animals, and then science and information technology and AI is on everyone's mind these days. So I appreciate your innovation in bringing this to light. So in just a moment, I'll show everyone the show notes and how to connect with you. But thank you so much for taking time and being on the podcast and sharing your vision and your journey with us.
Well, it's a pleasure. And we're all here to try to make a difference for the good of our community, for the good of other people. So you are too. And I really appreciate collaborating with you. Thank you for hosting this.
I really hope you enjoyed that conversation as much as we did. Be sure to connect with Dr. McNabb and learn more about the work that he's doing. You can find the links to connect with him on the show notes page for this episode. The show notes page for this episode, which is episode 409, can be found at phecpodcast.com. Once you're there, just navigate to episode 409 to find the show notes. Now, there's one more thing before we go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with other public health professionals around the world. It's a growing community that we're excited to share. And if this is the first time you've tuned into this podcast and this is the first episode that you're listening to, no worries. We invite you to join our community and just jump in. You can download our new PHEC podcast community app in Apple and Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. Again, links will be shared with you on the show notes page if you happen to be driving, exercising, or doing something else where you can't stop and click or look for a site. So once you navigate to the show notes page, you'll find the links for everything you need. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.